These are my 3 favorite soft tissue spots to hit with someone with either stiff hips, pelvis, or low back pain. The first one is actually the glute max, but we're not working on the entire glute, we're working on the lower fibers, which we find some more tenderness there, but we also get a bigger neurological effect because of the area we're kind of hitting. So what we do here is have the person lie on their side. We're going to find their greater trochanter, which is the bone on the side of your hip that usually bump into tables, and we go slightly below that. And what I want to do is I want to stay below that level because that's a lower level of the glute max. And I'll usually use a thumb here and I'll press straight down against the pelvis, and you'll be able to find some spots that the person finds a little bit tender, but we just want to generally deliver some stimulus to this area to allow it to open up. Now the next spot I'm going to have the client lie on their back is the adductor magnus muscle. This muscle runs sneakily down the thigh, pretty far down close to the knee. So it attaches to the adductor tubercle, which is right on the inside part of the knee. So that's where we're going to start. We're going to put a finger right in here, and what we're going to do is just press gently down this area, and we can move up and down the adductor here. And what we want to work on this for is because it's a pretty big muscle of the hip and low back area that actually produces a ton of internal rotation and adduction, as a huge leverage as well for hip extension. So we want to make sure this muscle is working well so we can allow it to have some neurological stimulus for decreased pain and maybe improved movement as we start loading it. Now the third one is going to be the iliacus muscle. The iliacus muscle is the part of the iliopsoas that the ilio comes from. Now, where we're going to find this is we're going to find the inner part of the hip bone, which is that bone right in the front, and we're going to go just to the inside, and we're going to kind of hook around into the inside towards ourselves if we're on the same side. So I'm going to bend the knee up here just to make it a little more relaxed. I'm going to press right in here. I'm going to press to the inside. I'm usually going to hold this. You don't need to really rub up and down. You just have a holding pressure right there. This is usually going to work a lot better if we're trying to attack the hip flexors, much better than the psoas muscle that people try to attack through the stomach. Getting down the psoas muscle through here is like trying to find a cheese string through 5 pounds of steak. It's just not going to happen. It's a smaller muscle, but the amount of meat that you have to get through is too much for us to really find it with our hands. Usually when you press in here, people do report discomfort, but it's most likely because you're pressing on their guts. So this is an easier way to know that I'm working on the muscle directly and not anything else. If you open those 3 areas, generally the pelvis and the hips will start moving better, and then we can translate that into better low back pain.